afternoon and welcome to another edition of Daily Clout. This is Breeauna Sagdal, the Associate Editor, and I'm joined this afternoon by Representative Steve Haugaard. Steve is the former Speaker of the House for the South Dakota State Assembly. Representative Haugaard, thank you so much for joining me this afternoon. How are you doing?
Thank you. Very well, thank you, and thanks for the opportunity to express some of my viewpoints.
In your opinion, do staffing shortages in healthcare, be it either due to, say, vaccine mandates or otherwise, does that impair or impact South Dakota's ability to meet the needs of this pandemic head on?
Well, of course it does, and I'm sure that there's priorities made in each of the hospitals and any healthcare facility as far as addressing the most emergent needs that exist. But certainly staffing issues are important. And what happens oftentimes is there's a stopgap of federal money that flows in when there are these situations at least with the COVID-19 issues. So the idea that you're going to potentially lose a lot of staff people because of a potential vaccine mandate, and then you're going to have to bring in new folks that are probably on contract basis where you're going to pay them 2 to 3 times as much as you'd pay your regular staff. That's just not wise business practice for one, but it also creates some degree of inconsistency in the healthcare as well. So those are concerns, and that's why I think the legislature needs to be in session right now to address some of those issues.
Is there a potential that we might see lockdowns or school closures if things continue to surge the way that they have?
Well, I get the impression that there is such a pushback on the idea of any lockdowns or closures that's less likely to happen. Now, it might happen at schools where they could continue their education via the internet, but businesses, I don't think, are going to sustain another shutdown like we had last year. So it's interesting. We have these statistics that show there's significantly high numbers of infection and hospitalizations, but I don't hear anybody talking about the idea that it's time to close down businesses again. Along with that idea too is, last year when the shutdowns took place and the healthcare organizations shifted their attention to COVID, expecting this massive number of people to come in, and then that didn't really happen. We've got the COVID right now that seems to be consuming a lot of ERs and ICUs. So just a lot of issues that once you start prioritizing some of these things, you got a massive ripple effect.
I know that one of the concerns that have been expressed with the vaccine mandates and then potentially the vaccine passport is that individuals would be potentially prioritized between vaxxed and unvaxxed, essentially creating a 2-tier class system. And from my understanding, now there's this legislation that's been introduced in the
South Dakota legislature.
Thank you, in the state legislature, to mitigate that sort of discrimination and segregation. Would you like to tell us more about this bill?
Well, I think what it would do, and right now it's just a draft bill. We can establish or ask our staff to put together draft bills any time of year. And so it's just a draft, it's a working draft, it's something to consider, and it's a starting point. And the focus of that draft bill was really generated by Representative Speaker Pro Tem John Hansen from Del Rapids, and then also Scott Odenbach from out in the western end of the state. And they're both attorneys, both considered the issues that are facing us right now. So the bill that they have is focused more on conscience. It's not necessarily a religious liberties issue, but it's more of a conscience issue, and there's a definition contained within it, and it's conscience defined. It says, for the purpose of this act, conscience means a person's inner conviction of what is right or wrong in his or her conduct. And so it's pretty broad. And I think you almost have to be in that category, because if you try to narrow this down to, well, I have a religious objection to the vaccine, for example, well, then define your religious objection, and then that becomes a matter of discretion among employers and anyone to whom you have to answer. So the right of conscience is really more of the idea of, do you have a deeply held conviction based on whatever your information is? And are you acting on that? Are you making your decisions based on that quote unquote right of conscience? So I think it's a good starting point for the discussion. And from that, then you consider what are all the ramifications across the United States with other legislation, other federal acts, past Supreme Court decisions, and if there's any clear connection or issues associated with our constitutions, both federal and state constitutions. So again, it's just a working document, and I think it'd be wise for us to be able to convene and address this, because it's a here and now issue.
You're referencing calling a special session. Is that right? Correct.
And sometimes there's an objection to a special session because of the cost. Well, the cost is, I don't know if it's even $50,000 right now. It's a matter of so many people based on our established practice over the past year and a half now. So many people will likely attend via a Teams call so that you're online, and the actual costs are then reduced to very little. But it's an opportunity for us to get together. And if you say it was $50,000 or say it's $100,000, well, if there's an action that takes place that affects 1,000 employees at a business, well, it doesn't take very long to run up $50,000 or $100,000 worth of lost wages or expenses, delayed medical procedures, all that sort of thing. So it's important, and I think we ought to be convening to address that. So to that end, I sent a letter to the governor last Friday morning, so a week ago, and encouraged her to either issue an executive order based on the fact that she did the same thing in 2020. She issued executive orders directing businesses to do certain things then, and she could do the same thing now. But if she doesn't want to do that, if she doesn't want to take on that sole responsibility, and I would suggest it's more appropriate for the legislature, then she ought to call a special session of the legislature. And of course, the fallback on that is the legislature itself could call us into session, but it takes 2/3 of both chambers to do that. And I don't think that we have that momentum. And the reason for that is just the business pressures to leave it alone. And unfortunately, too many times legislators will respond to those business pressures, whether they're moving in the right direction or not. But this is a responsibility I think we have, and we should tackle it. And I don't know what direction legislation might go coming out of this, but at least then we can have the conversation and represent the interests of the people all across the state, as opposed to one person or, the 70 in the House or the 35 in the Senate. But you'd have an opportunity to hear from people all across the state and then make an informed decision following that. And I, the opinion I have is just based on the idea that you can find people on both sides of this issue just adamantly convinced of one side, and you go 180 degrees the other way, and they're adamantly convinced that position. And it would be good to be able to convene, to have a session, to then filter through the information and actually figure out what is fact and what is fiction, and then make decisions based on that. But too many times what we have right now is we just have generalized information. And this existed last year. I asked our Secretary of Health last year during the pandemic, would you please give us information about the severity of these cases? Because say, for example, on any given day, we might have 1,000 reported infections. Well, I wanted to know, were 950 of those of no consequence and 50 were significant, or was it more than that? And I think all the people in the state and all across the nation, they need to have better information so they can make more informed decisions.
I would agree that this conversation is largely being silenced and shut down. And it's unfortunate to see my colleagues in the media having, participation in that.
Well, it's unfortunate because people really get entrenched, and once you start taking a position, it's really hard to back up. Even when you get better data, better scientific information, it's really hard to back up and say, well, I guess I was wrong before, and now I'm changing my position. That's just not the nature of the way people live their lives. They become more and more convinced and more entrenched in their position, whether they're right or wrong. And I think we could do a good job gathering information, letting the public see it and hear it, and recommend to us what they think the results should be. And that's a constitutional representative republic. That's the form of government that we have. And if we're going to address this with legislation, that's the way it should take place. But up to this point, it's become us against them from all directions, and based on very little good, absolutely reliable information. So there'll be people that think both directions on that subject, that they've got the best information, the other side says they've got the best information. It would be good to get that out, evaluate it, and make some better decisions.
Governor Nome had recently made a video on, I believe it was Facebook Live, and she said, this is how I really feel about the situation. And her perspective was that it was not conservative or a Republican stance to get in the middle of business practices. I was wondering if you might be willing to comment on that.
Sadly, oftentimes things boil down to government intervention. And our country, our state, they're both founded on the principles of individual responsibility. But as life becomes more complicated and business becomes more complicated, and our overlap of federal and state has become far more complicated, you end up in these situations where there needs to be something done by the leadership, by the authority that exists currently to address issues. And the governor didn't have any problem addressing those issues last year. She issued her mandates, and you can go back and look at the executive orders. Those orders, at least one order in particular that was reiterated as a second time, indicated that her directive was mandatory for certain counties. So that existed. And then there was additional executive orders that went from a recommendation to a mandate, and it went from should follow CDC guidelines to shall follow CDC guidelines. And that addressed businesses all across the state. So it's not like this hasn't happened as recently as a year ago. And for us to just turn a blind eye now because business seems to suggest that we should stay away from this, that's not wisdom, and that's not leadership. And the issue, though, is very complicated because it isn't just, there's nothing in the Constitution that gives them authority to do this. Well, kind of true, but there is case law, and this case law goes all the way back to 1905. So we have 116 years of precedent where we go back to 1905 in a Massachusetts case that ended up in the United States Supreme Court, which addressed at that time, I think it was smallpox. So, and that was smallpox vaccine. So the same issue, but over 100 years ago. So there is precedent, but then following that precedent, there has been a development of the analysis of constitutional law. So after 1905, there was an expansion of what are the parameters on a constitutional issue, whether you apply strict scrutiny or some other degree of scrutiny to the issue. So those are complicated, and that's a matter of constitutional law and interpretation of constitutional law. That's why these cases, if they're going to proceed forward, they probably need to get in the pipeline pretty quick. And I would like to think that whether it's at the state level, then state applied or appealed to a federal appellate court, whatever it is, I would like to think that those things would be fast tracked and you'd be able to get an expedited consideration and response, because this is has a potential to devastate not only the economy, but people's lives. So when we had these lockdowns, we weren't considering all the long-term ramifications. And when you lock down a county or a state, and all of a sudden people are maybe they can work from home, but they're not having the same interaction that they've had in the past. And so the mental illness calls went up, I think in Minnehaha County last year, they went up by 130%. So a dramatic change. And these things have a significant impact on people's lives. We need to be attentive to that. And then, just like I mentioned before, the idea that you can delay all these elective procedures, and people are suffering with an elective issue, or maybe they don't have an immediate need for a heart procedure, but you don't know what the ramifications are for that. It becomes far more complicated. So these decisions we make, they just have ripple effect all across, whether it's in healthcare or it's in personal behavioral issues, interpersonal relationships, or the business environment, the dramatic issues.
And if I may, some of these procedures are not even elective. There's a hospital in New York that just recently announced that it was no longer capable of delivering babies because they lost their OBGYN nurses and doctors due to the mandates. You can't exactly put off delivering a baby. So this is a growing
Those are
issue.
interesting. Those are interesting issues, because you have healthcare workers that are not uninformed about vaccine issues or ramifications, right? And they're making decisions, some of them, not to proceed with the vaccine. And maybe they're making that decision without good information. I don't know. And that's why it would be useful to have a special session to at least elicit some of that information and try to make better informed decisions. You know, last year when the mandates took place in South Dakota and people were required to follow CDC guidelines, we were doing that without having adequate information. And I had asked repeatedly the Department of Health for data to tell us how many people are having severe consequences from this infection, how many people are having moderate symptoms, and how many are, not really an issue at all. So we needed that information to make better informed decisions, and we still need it. And that's true all the way across the United States. So many of these issues are politicized, and like I say, people end up on either one side of the issue or the other, and it's not really sometimes a matter of absolute convincing scientific fact, but rather it becomes a matter of faith in, I want to believe this person or I want to believe that person. And that information needs to be clarified, and then you can make better informed decisions. And maybe if there is still an element of doubt, at least you could give some general guidance to businesses, and hopefully businesses and individuals, and hopefully people would ease back a little bit and make better long-term decisions, both personally and business-wise.
If people wanted to help call for a special session or help support the efforts to get this bill before a vote, what could they do? How can they help?
Well, they could specifically contact, if you go on to our state legislature's website, it's www.sdlegislature.gov. There you can find information about what's currently going on. And from there, you could also find the names of all of your representatives and your state senators. And you can send an email to all of them, to the governor's office, to our staff, and our staff will keep track of those types of requests. And in fact, you can send an email to every member of the legislature, all 105 members, just with one email. So it doesn't have to be cumbersome, but you can actually do that and express your interest in why you think it's important to proceed with a special session. or to address this in some form or fashion, whether it's, like I say, whether it's another executive order or it's a special session. But I think the benefit of the special session is then you'd actually be able to gather some information and people could see that and make some well-informed decisions for themselves.
Right. And just one more point about the executive order. What would happen if, say, for some odd reason, Governor Christino, lost her election next cycle and she was no longer governor? Would her executive order still stand? Would those protections still be in place? Or is that only done through an actual codified law, such as the bill you are proposing to pass?
Well, it depends on the expiration date of that executive order and whether or not there's an ongoing emergent situation. So the orders could be for a specified period of time, or they could be indefinite, but then with a new governor, that new governor could make cause an order like that to be rescinded or make their own order, whatever they might choose. The best process is always going to be going through the legislature with an evaluation of the information, coming up with legislation. And if a governor affirms that, that's great. If a governor vetoes that, then if the legislature by 2/3 can override that veto, then so be it. Then you've got the will of the people being represented, presumably. So executive orders are okay. They should typically be a last resort, but it's there for a purpose too.
Absolutely. And if people wanted to get in contact with you or support what you're doing in any which way, is there a way that they can stay in contact with you?
Yep, they can certainly go on the state legislature website, look up my contact information and send me an email, and I'll be glad to visit with anybody about the issue.
Thank you again so much for your time. We really appreciate you.
Thank you.